Middlesex County, Cathy Burghardt-Jesson, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. Welcome to the media who are joining us this afternoon as well. Just remember that if you do have a question for one of our panel today, to just enter that in the question forum here on Microsoft Teams. If you click on the speech bubble with the question mark in it and indicate your name as well as your media outlet and who your question is for. And finally, a welcome to those who are tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. We do have a lot of questions already, so let's get to the opening remarks right away, and we'll start with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. So if anyone had any lingering doubt, I think it's painfully obvious we're now clearly in the midst of the third wave. Unfortunately, Saturday also served as a somber reminder that despite the vaccination campaign, COVID remains a deadly threat locally, as we had our first COVID-related death in more than 2 weeks over the weekend. Yet I was still encouraged to see so many people across the region taking part in our silent tribute to COVID victims Saturday night by placing candles outdoors or leaving porch and balcony lights on. As we know, this past Saturday marked exactly 1 year since the first COVID-related death in our region. So despite all the positive signs, we had another one today with news that people 70 and over can start booking vaccination appointments. Despite those positive signs, we're in a real dogfight. We're right in the thick of things, and it's an exceptionally precarious time. We've seen our case counts skyrocket in the last 5 days, and even if deaths are lower than what they were in waves 1 and 2, the strain this will inevitably place on our healthcare systems and ICU is simply not sustainable. Look, I know there's a lot of interest, and for good reason, about our color tier system, but as I've said for months, these restrictions, without a genuine commitment from all of us, those restrictions in and of themselves aren't going to save us from ourselves. We must remain vigilant. We need to hold each other accountable, and we need to think about each other. We need to care about each other. And that's what this comes down to. I hate for someone in their early 70s today to be unable to book a vaccination appointment because they're hooked up to a ventilator in the ICU or battling COVID. I'd hate to see someone who needs treatment for an unrelated illness or condition be turned away or told they'll have to wait because our hospitals are being overrun with COVID patients. These kinds of scenarios, friends, are totally avoidable and entirely within our ability to control. So let's start acting now so we can spare ourselves and loved ones the types of outcomes none of us want to see. Well, thank you, and over to you, Warden Cathy.
Great. Well, good afternoon, and thanks very much, Mayor Ed. There is no question that the spike in the number of positive cases over the last few days is deeply concerning. There is no question we are in the third wave. I had the opportunity to volunteer this weekend out at the Mount Bridges vaccination clinic, and that was the topic of many of the discussions I participated in with those coming in for appointments. I know the case jump is troubling to our communities. Our small businesses will feel particularly threatened. We are all tired of the restrictions and the volleying back and forth between what we can or cannot do, how we can or cannot meet. I get that. I'm just like you. I'm tired. I'm burnt out. And frankly, I want it all over. But you know what? And I know that you're tired of hearing me ask you to adhere to the parameters of being placed on you. Today, I'm imploring that with you. It seems that on more than one occasion, I have used the saying, now more than ever. But seriously, it is now more than ever. As the mayor alluded to, the strain on our healthcare system, it's a ripple effect that not just comes from our communities, but from right across the province. We need to not only think of ourselves, but we need to think of others. So it's important that you need to limit your trips out. Trips need to be limited to essential trips only. Your bubble needs to be held tight. With Passover continuing this week, with Easter on the weekend, and then Ramadan not too far off, we have to celebrate virtually. The work you put in now will go a long way in curbing the spread. Please do your part. While you are mindful of the restrictions and limited trips out, please always choose to support and shop local first. There are so many options our retailers have made available to us that online shopping from mega internet sites is really not necessary. Whether it is a local grocery shopping or your hardware needs or daily incidentals, local retailers will make it easy for you. As always, when you are able to, consider having someone else do the cooking for you and do takeout from a local eatery. Things seem, and quite frankly, they are challenging for all of us. For some of us, the challenges will affect us more so. So always be mindful of the struggles others are experiencing. Be kind, support local, be physically distant, wash your hands, wear a mask, and stay at home. Dr. Mackie.
Thank you very much, Mr. Mayor and Madam Warden. So for many weeks, this region has seen lower rates of COVID than any other comparable community. If you look at any of the communities our size or larger across the province, on 9 days out of 10, rates in Middlesex-London have been lower. Over the last week, we've seen rates here almost double, from very few days over 30 to now 5 days over 30 in a row, including a high of 79 new cases reported on Saturday. This is the home stretch. We are nearly through this pandemic, but this home stretch will last a lot longer if we continue to gather indoors. Moving to the red level in the framework will not solve our problem. What we need is a wholesale change in our attitudes and behaviors about indoor gathering. We must keep our gatherings outdoors. Stay outdoors, please. There is no good reason for a social gathering indoors right now. I don't care where it is or who it's with. Keep your gatherings outdoors. I am going to share some specific information that has accumulated over the past weeks in the form of some slides. If I may share my screen. Will that work, Dan?
Yes, it will, Dr. Mackie.
Great. I'll bring that up just now.
I know we've done this in the past. It seems to maybe...
I think there's just a bit of lag. There we go. Is that coming up? Do you see the slides, Dan?
I do not. Angela, can you give me an indication if you can see it?
Cannot see the slides.
How about now?
Yes.
There we go. Yes.
Great. So this is our weekly percent positivity, and we're comparing Middlesex-London to all of Ontario. You can see with rare exceptions, the rate of infection here has been lower than across the province. However, you can also see that over the period of March, we have really seen an increase here to the point where we are now approaching the beginning of the spike in wave 2. These are our cases by week in green. Variants of concern are the cases in orange here. So you can see that since mid-February, we've seen dramatic increases both in the rates of COVID cases diagnosed and also in the rates of variants of concern in our community. There are essentially two pandemics happening at the same time now. The wild type or the previous variants of COVID are increasing because of increasing indoor contacts in our community. The variants of concern are also increasing, and we know those VOCs spread around 50% more easily. We also know from data released from Toronto over the weekend that those variants of concern can also be more fatal, particularly in young people. I flag these for you because we have outbreaks in our community that are linked with variants of concern. 3 of the outbreaks at Western University have had at least one variant of concern confirmed. We've also had variants of concerns from several other places. Western has a lot going on right now. it's still in the range of 20% of our overall community problem. So there are certainly things there, but there are problems throughout our community with people gathering indoors. This is our incident rate averaged over the last 7 days. You see the peak in April, May from the first wave. You see the very high peak at the beginning of January for the second wave. And you see we're exponentially increasing, really skyrocketing in terms of the incidence. That big break in the upward direction is just over the past week. Most concerningly, any numbers we see today are actually reflective of activity 2 weeks ago. We know that it takes that long for symptoms to develop, for people to go in to get tested, and for those test results to come back. That means in terms of where we are in this third wave, we're actually 2 weeks further down the line right now. In other words, if you look back to November, December, and see where we were in kind of mid-December, you can predict roughly where we will be in 2 weeks, and it doesn't look good. This is the same information by episode date. Essentially, you ignore the last week because those people still haven't been tested yet. Again, it shows a concerning trend. This drop-off is artificial because those cases haven't been reported yet. That's all I wanted to share. The key message hopefully is coming through loud and clear. We're seeing a dramatic increase here, really a doubling over the past week of numbers that were already on the borderline for red zone. If you take the cases we had over the last week, we're now at around 65 cases per 100,000 per week. The cutoff for red is 40. So when the province was making the decision last week, we had none of this data available. At the time they decided, we had rates that were still continuing on at the high orange level. That really changed over the weekend, and that's why this change will be implemented tonight. Hopefully you also saw the good news for today, that we're able to open vaccinations to those age 70 and above. So everyone who was born in 1951 or earlier is now eligible in this community for the vaccination through the mass vaccination clinics. There were about 5,000 appointments available this morning when I was first announced. I understand those are disappearing quickly, but we will be putting new vaccine appointments on the covidvaccinelm.ca website every morning between 7 and 8 a.m. With that, I'm happy to pass to Dr. Dukelow to speak from the LHSC perspective.
Thank you very much, Dr. Mackie. Appreciate the opportunity to join this team in today's briefing and provide an update from the London Health Sciences Centre perspective on our COVID-19 situation. Although we've just heard some somber news and reflection from Dr. Mackie, I'm happy to share a bit of good news this afternoon that on Saturday, the COVID-19 outbreak on the 4th floor medicine unit at University Hospital was resolved and LHC is once again outbreak free. Our enhanced outbreak and precaution measures have proven to work effectively as the outbreak remained contained with low associated case numbers and no deaths. We hope the swift resolution of this outbreak is reassuring to our community. We will continue to do everything we can to prevent future outbreaks and contain and resolve any that do occur. The hospital is a safe place to receive care. Our emergency departments are open and safe, and we ask people to not delay seeking emergency care when it is needed. While the resolution of the outbreak is welcome news, I am also sharing that we're continuing to see COVID inpatient cases fluctuate in the lower double digits with 16 today. Fortunately, we have fewer than 5 of those patients in our critical care. While our occupancy remains in a relatively good position, this is not the case across the province, where many hospitals outside the region are experiencing intense pressures as they reach or are near capacity. In fact, the total number of ICU patients with COVID across Ontario is only 6 shy of what it was at the peak of Wave 2. There are 409 patients in ICU beds across Ontario today, and at the peak of Wave 2, there were 415. This is very different from the beginnings of Wave 2, when there were less than 50 ICU patients across the province, where we eventually reached that peak of 415. So as we look ahead to the upcoming holiday long weekend, we know we will need the support of our community to help prevent our local hospitals from experiencing these same capacity challenges. As Dr. Mackie mentioned, diagnosing the cases is 1 to 2 weeks behind when someone contracts COVID-19. Hospitalizations are yet delayed another week or two from when they are first diagnosed in most cases. We are asking that everyone please continue to follow public health guidance to limit the spread of COVID-19. Let's do all we can to keep ourselves and each other safe over the holidays that our warden mentioned. Wear a mask, physical distance, and limit your social interactions to those in your immediate household. Thank you, and I look forward to your questions.
Thank you, Dr. Dukelow. Thank you, Dr. Mackie, Warden Burghardt-Jesson, and Mayor Holder. We do have a lot of questions, so let's get to them right away. Steve Young at CTV and News Talk 1290 CJBK. Dr. Mackie would like to know, what's the latest on the outbreaks at Western?
Yeah, thanks for the question, Steve. So we have 3 outbreaks that we're tracking that have been recently diagnosed at Western. 2 residences, Saugeen Maitland and Ontario Hall, both have 11 cases each. And a third associated with a business student social gathering where there have been 10 additional cases. The 3 outbreaks there have all had at least 1 case that has been confirmed with one of the variants of concern. So that obviously is a worrying picture. If those variants, well, we know those variants are spreading through the university community. So that community needs to be particularly cautious now to avoid indoor gatherings.
Thank you, Dr. Mackie. The next question is from Jane Sims at the London Free Press. Last week, you said MLHU had received notification of how much vaccine would be coming into the area and that it was unlikely we would be receiving any more of an allotment over the next couple of weeks than we had been getting already. However, today we opened up the age cohort to people aged 70 plus. Are we doing this because other parts of the province are opening up too? Did we get more vaccine? Do we have enough vaccine for these new appointments?
Yeah, so Jane, this is a natural progression. As we get people vaccinated, we move on to the next group. As of Saturday, we had about 11,000 people from the age group of 75 to 79 that had been booked for a vaccine. That's about 2/3 of that population, and have booked several thousand since then. What that means is that appointments are starting to open up along the 2-week horizon towards the end of that time period, so that it's time to get other people in to book those additional appointments. We, as of this morning, had about 5,000 appointments that had not been booked. Now, those are not today, they're not tomorrow. Almost all of those are at the end of that 2-week period. But in order to make sure people are getting into booking those appointments, we open them up to 70 plus, make sure we're maximizing the use of the vaccine. The other thing that we will be doing over the next couple of days is we'll be opening up a 3rd week of our vaccine schedule. We are starting to see the predictability of vaccines gradually improving. That means we have a little bit more visibility out beyond 2 weeks to know, if not exactly how much vaccine we'll be getting, approximately how much. It gives us confidence to open up not all but some of the appointments in that 3rd week. We are currently vaccinating about 2,000 to 2,500 people per day. And so, in that 3rd week, there are over 15,000 vaccine appointments that will be available. And we are opening about half of them up tomorrow for the age groups, tomorrow or Wednesday, as we confirm the logistics of that. For the age groups, anyone who is eligible by age, which includes now anyone age 70 and above. So again, it's a natural progression. As we finish the group of age 70 and above, we'll move on to the next group. We know that we're not getting 100% of any of those age groups. What we're doing is we're booking as many people who are interested right now as we possibly can. And rather than holding those spots open for those who aren't necessarily coming forward right away, we want to open them up to the next age group for those who are interested in coming forward and getting vaccinated right away. Very encouraging. This is the population. People over age 70 have been historically that cohort has been excellent at coming forward to get vaccinated. They're among our highest rates of vaccination each year for the flu shots, and not surprising to see very good uptake there.
Thank you, Dr. Mackie. Follow-up question from Jane Sims again, and Dr. Mackie, this is for you and also for Dr. Dukelow. With the dramatic case rise here, there's concern about hospital resources. How many people are in the ICU? Are you anticipating more patients either from this health unit or from other regions? Dr. Dukelow?
Thanks very much, Jane and Dan. So we currently, as I mentioned in the opening remarks, have less than 5 patients in our ICUs, but as the case counts climb, we know that we will have a further draw on our resources for COVID patients. And similar to the past weeks where we had taken patients from Thunder Bay as they were in trouble and previously taken patients from Toronto and the surrounding area, we anticipate that type of load leveling across the system will occur. London has, as Dr. Mackie mentioned, done relatively well throughout this COVID pandemic relative to other centers across the province, but we are part of a larger system and we will use the resources to care for the patients that need it most.
Thank you. Dr. Mackie, anything to add?
No, I think Dr. Dukelow really hit it. There have been, as we've mentioned on this call previously, some patients who have been transferred here from across the province over time. I would imagine that starts to happen more over the next few weeks with the pressure really going on to the ICUs. 382 patients in ICU across the province as of yesterday. That's very close to the peak of just over 400 that we had at the peak of wave 2, and is climbing quickly like the case counts. And so, that whole intensive care system will see a lot of pressure in the coming weeks.
Thank you very much. The next question is a quick one, Dr. Mackie, again from Jane Sims. Has the health unit considered starting a daily overflow list so people might be able to slot into no-show or canceled vaccination appointments?
So there are a couple of questions here, but the primary one is about vaccine wastage, and we are essentially wasting zero vaccine. The clinics, at the end of the day, when the last vial is opened and all the patients have been vaccinated, the staff are turning to either healthcare workers in the clinic who haven't been vaccinated yet because they've just been hired or for whatever reason, or to anyone who is already on the list to be booked over the next 2 weeks, calling those people in to get vaccinated. So essentially, I just want to be very clear, there isn't an issue with vaccine wastage here. There also isn't an issue with appointments not being filled, because if there are any appointments that aren't filled in a given day, we simply put those back into the appointment calendar for the next 2 weeks. And so we're laser-like focused on the groups that are eligible. We're making sure those people are being booked in as quickly as possible, and there's no capacity that's going to waste here in the community. Essentially, our end-of-day process is to bring forward anyone who is already eligible, make sure they get vaccinated. I know other communities have been doing things a little bit differently and having sort of a back door for those who might not be eligible or those who might be able to come quickly. We are operating in a community where the vast majority of people, to be fair, not everyone in the county, but the vast majority of people can get to those clinics very quickly. And so we really don't have an issue filling any spots for end-of-day doses.
Thank you, Dr. Mackie. And it's interesting you mentioned the warden and the county, because the next question, Madam Warden, is for you. If Middlesex-London goes into red, and we now have the news from the province that it has, do you feel it penalizes those in the county where the COVID numbers are very low?
Well, thanks very much for the question, Steve. I think a year ago, my answer would be very different than it is today, because we have learned so much about how this disease works and how it travels. And really, the only approach that we can take is a regional approach. Our neighbors with the City of London, there's so much border crossing, and we know that COVID can affect all of our communities. If you look at the incident reports on the dashboard, in fact, my small community of Lucan Biddulph is number 3 from a per capita basis at the number of cases that we've experienced over the past year. So I understand the frustration from small businesses in the community and our residents, or in the county, excuse me. I get that, I certainly do, but we have to approach this on a regional basis and understand that we're all partners in this together and we're all in the same fight. And, you know, 1 or 2 cases come into a small community. It could be a vastly different situation than just 1 or 2 cases in London.
Thank you, Madam Warden. The next question, Dr. Mackie, is for you. Heather Rivers is joining us from the London Free Press. It's a lengthy question, so bear with me. Dr. Peter Juni of the Ontario COVID-19 Science Advisory Table, a panel that advises the provincial government, says he believes even the strictest level of the province's pandemic framework isn't enough to reduce spiking infections from more contagious variants. If this is true, why aren't we facing stricter measures to stop the spread, or is Ontario waiting for the April break for students to shut things down?
Well, I think one thing that Dr. Juni's comments point out is that no level of restriction will be effective if the community and population don't support it. If people continue to gather indoors, in spite of restrictions, we'll see spread regardless of what the official restrictions are. On the other hand, if people are able to keep their distance and avoid indoor gatherings, we'll see control of this pandemic very quickly. The question of why the province hasn't gone to higher levels of restrictions is one that only the provincial government can answer. My understanding, I mean, you can see in the provincial COVID plan that maintaining businesses being open in order to maintain a strong economy is part of the objective of the pandemic response that the province has put in place. And of course, you know, a strong economy is important for health as well. And so from a determinants of health perspective, that is certainly a goal that has a potential to contribute to health in the long term as well.
Thank you, Dr. Mackie. And a follow-up, in the reports coming out of the US, the variants of the coronavirus are responsible for the largest increase in cases in the age group 10 to 19. Do we know yet how the variants have affected who gets the virus? What are the demographics now of the virus in our area?
Yeah, we have not seen a lot of variants of concern in the population 10 to 19. We've seen the variants spreading in a similar way as the previous variants, the wild type virus of COVID. It does spread through young people, university age population first, and then spreads to other age groups. I believe we've only had 1 case associated with any of our schools. We really don't have a lot of spread of COVID in schools right now. We're identifying 1 or 2 cases here and there by school. There's only 1 school-based outbreak. We declared the other one over the weekend. Again, that school-based outbreak is only 2 cases. So variants have not been a big factor in those aged 10 to 19 in our community. I think we mentioned last Thursday that we've had over 100 of the tests done in asymptomatic people. 112 was the count on Thursday, and 0 positive for COVID among asymptomatic testing in students in schools.
Thank you, Dr. Mackie. The next question is from Sophia Rodriguez at CBC London. Dr. Mackie, considering the province's response framework has been tweaked recently to allow more businesses to operate while a region is in red, will moving us into this zone still help curb the spread of the virus? And if so, how so? Sure thing. And we've kind of talked about this a bit, but essentially no level of restriction will control the spread of COVID if people aren't complying with it and keeping their distance, avoiding indoor gatherings, wearing masks, etc. So no, moving to red won't solve this pandemic if people don't take it up. That said, this is our last chance really to avoid a significant lockdown. If we want to avoid a lockdown where businesses, restaurants are significantly hampered, closed, and inaccessible, now is the only chance. It's our last chance to avoid that really much higher level of restrictions. And so I hope we can take it. Please stay outside. There is really no excuse for any social gatherings inside right now. Thank you, Dr. Mackie. And we do have several questions left in the queue, and I know people have some busy schedules. Just want to check if people can stay on for a few more minutes. No? Okay, Mr. Mayor has to leave. The warden has to leave. Dr. Mackie and Dr. Dukelow will be able to stay on. So a big thank you, Warden Burghardt-Jesson and Mayor Holder, again, for participating in today's virtual media briefing. And Mayor Holder, we'll see you on Thursday. Madam Warden, we'll see you next week. All right, the next question is from Sheetal Vemanagari. My apologies, Sheetal, from the Western Gazette. Dr. Mackie, are there any new cases from fraternities or sororities? Are there any new cases in residence?
Yes, so I mentioned those 3 new outbreaks associated with students who attend Western. None of them are particularly associated with fraternities or sororities. So I hope you were on, Sheetal, when we spoke about the outbreaks in Saugeen-Maitland, in Ontario Hall, and associated with the business students social gathering.
Thank you, Dr. Mackie. And Sheetal did have a follow-up question. And I know there are some new restrictions and guidelines for the housing on campus, the buddy system and such. And Sheetal is asking, are the new restrictions for Western University housing ones recommended by the MLHU?
So the new restrictions at Western have been a collaborative effort looking at what is possible for Western students in partnership with the university and with the health unit. So we certainly support that. And those are being implemented by Western, which is, I think, a big hand up.
Thank you, Dr. Mackie. Jacqueline LaBelle has the next question. Dr. Mackie, are there any concerns for Passover and Easter celebrations from a COVID-19 perspective? Have you been sharing messaging with local religious organizations?
Yeah, for sure. And our comms team has been doing that. We have had a similar approach to what we've used in the past with red, yellow, and green. There's some activities like, large dinners indoors, which are definitely red, do not do. And then other activities, small gatherings outdoors, distance mask, that are much lower risk, and we certainly support for those events.
Thank you, Dr. Mackie. We've got a question from Brian Wood at Newstalk 1290 CJBK. Dr. Mackie, were there talks of jumping directly to the gray level for Middlesex-London with the upcoming Easter long weekend? And as was pointed out by Dr. Mackie, a very similar trend to what was observed in December.
The level of illness spread in the community is clearly at the red level. There won't be any hesitation to move to a higher level if that's what's needed to stop further spread in our community.
Thank you, Dr. Mackie. Craig Needles is joining us this afternoon from Blackburn News. Welcome, Craig. Craig asked Dr. Mackie, does the announcement from the federal government about the AstraZeneca vaccination not being given to people under the age of 55 make Dr. Mackie concerned about the speed of vaccine rollout?
Well, we have a lot of distance to go before we, by the way, welcome, Craig. I'm not sure we've seen you on this call before. Great to see you back at Blackburn now. So we have a lot of people to vaccinate, but it's before we get to those age 55. And so I still see AstraZeneca as a big part of what we are doing as a community here, and it will continue to be helpful. Does it slow us down in terms of long-term goals? It certainly will be a factor. What we're hoping is that Johnson & Johnson's vaccine is available by sometime late spring or early summer to try and fill in that gap.
Thank you, Dr. Mackie. We have just one question left, and Sheetal is back from the Western Gazette. Thank you, Dr. Mackie. Is the business students gathering from students at the Ivy Business School?
So my understanding is they're business students. They were associated with Western, and I don't have exactly whether they were Ivy or other business students. And it may have been that there were a combination. I'm afraid I don't have that for you, Sheetal.
Thank you very much, Sheetal. And thank you to everyone for your questions this afternoon, and to Dr. Mackie and Dr. Dukelow for your time, and again, your expertise and insights as we continue with the COVID-19 battle, as it were, that we've been in for more than a year now. Thank you for joining us as well. We will be back with our next virtual media briefing on Thursday afternoon at 2 o'clock. So between now and then, have a great rest of your day and take care. We'll see you on Thursday.